wake up in the dark, and you already know where you are going. The clock says 2 in the morning. Your feet find the floor, and you make the same short walk you made last night, and the night before that. If you are past 65, you are far from alone in this. The majority of adults over 65 wake at least once every night to empty the bladder. It has become so ordinary that most people quietly file it under getting older and stop asking about it entirely. But there is a real answer to the question you have probably never asked out loud. There is a number. Doctors and continence specialists have a fairly clear idea of how many times a person over 65 can expect to wake at night, and how many times crosses a line that deserves attention. Most people are never told that number, and because they are never told it, they have no way of knowing whether their own nights are normal, or whether their body is trying to tell them something that matters more than it sounds. Every time you get up, your sleep breaks. Deep sleep, the kind that repairs tissue and settles memory, arrives in blocks, and each interruption costs you a block you do not get back. Then there is the walk itself. Getting up in the dark, half awake, with your blood pressure still adjusting to standing, is one of the most common moments for a fall after 65. Broken nights are not simply annoying. They carry consequences, and yet this is one of the least discussed subjects in the entire consulting room. Older adults who wake 3 and 4 times a night will often admit they have never once mentioned it at an appointment. They assume nothing can be done, or they assume it is just the price of being over 65. Meanwhile, the visit moves on to blood pressure and cholesterol, and nobody has 10 spare minutes to explain what is happening to the plumbing. That silence is the real problem, and it is why so much confusion has built up around this. By the end of this, you will know how many nighttime trips are considered normal after 65, and what number means it is genuinely worth a conversation with your doctor. You will understand the specific hormone that decides how much urine your body makes while you sleep, and why it changes with age. You will know the practical things you can do this very evening that make a measurable difference, and you will know the one ordinary habit that quietly cancels out every single one of them. Here is something I want to say clearly before we go further. This is not a discipline problem. It is not weakness. It is not something you brought on yourself, and it is not simply a matter of drinking too much water, whatever you have been told. What is happening inside you is mechanical and hormonal, and it follows rules. Rules can be worked with. The answer, when we reach it, is simpler than you expect. It is a single number, and it is easy to remember for the rest of your life. But if I handed it to you right now, it would be almost useless to you, because that number only means something once you understand what your body is actually doing between midnight and dawn. So let me show you the machinery first. Once you can see it working, the number will land properly, and you will know exactly what to do with it. Your kidneys keep a schedule. They are not simple filters running at one constant speed, like a tap left half open. Across 24 hours, they speed up and slow down on a deliberate rhythm. And in a healthy younger body, they slow down considerably overnight. That is why a 30-year-old can sleep 8 hours straight without a thought. Their kidneys have been told to stand down until morning. Something is giving that instruction, and after 65, the instruction gets quieter. The messenger is a hormone called vasopressin. It is also known as antidiuretic hormone, and it is worth saying slowly, vasopressin. Your brain releases it, and it travels to your kidneys with one main job. It tells them to reclaim water instead of sending it onward to the bladder. Picture your kidneys as a filter with a tap on the outflow. Vasopressin reaches over and turns that tap down. Less water leaves, more is pulled back into your blood, and your urine becomes more concentrated. In a young body, that release surges after dark. Research on kidney function and aging has consistently pointed to the same finding. That nighttime surge flattens as the decades pass. The hormone is still produced, but the sharp evening rise that used to shut the tap down for 8 hours becomes a gentle slope instead. Your kidneys never fully receive the message to pause, so they keep working through the night at close to daytime speed, filling your bladder while you are trying to sleep. Nothing has broken. A rhythm has simply lost its sharpness. The practical result is straightforward. After 65, you may produce noticeably more urine between bedtime and breakfast than you did at 40, even if you drink exactly the same amount you always have. This is the single most important thing to understand about your nights. For most people, the issue is not what happens at the bladder. It is how much fluid is arriving at the bladder in the first place. And now, there is a second mechanism, and it catches almost everybody by surprise. If you spend much of your day sitting, gravity pulls fluid downward into your ankles, feet, and lower legs. You may notice your shoes feel tighter by the evening, or see the mark of a sock band on your skin. That fluid has not left your body. It is parked. Then you lie down flat. Gravity stops holding it there, and it drains back into your circulation like a reservoir emptying. Your kidneys receive that extra volume around 1 or 2 in the morning. And they do what kidneys do with extra volume. There is a third route as well, and it is often missed entirely. If you snore heavily, or if your breathing pauses and restarts during sleep, the pressure inside your chest swings hard with every struggling breath. The chambers of the heart stretch in response, and a stretched heart releases its own signaling hormone that instructs the kidneys to release salt and water. Sleep specialists have documented this connection for years. In people whose disturbed breathing is properly treated, the nighttime trips frequently fall away as a side benefit. So look at what your body is dealing with after 65. A hormonal break that no longer grips as firmly. A reservoir of fluid in your legs that empties the moment you lie down. And possibly a breathing pattern that tells your kidneys to work harder at exactly the wrong hour. 3 separate forces, all pushing in the same direction, all of them ordinary parts of aging rather than signs of disease. But here is the part almost nobody explains to you. Everything I have described so far concerns how much fluid arrives. It says nothing about the container it arrives in. The container matters just as much. And this is where age changes the story a second time. The organ we need to look at is the bladder wall, and specifically, a layer of muscle inside it called the detrusor. The name simply means the muscle that pushes down. It is a mesh of smooth muscle woven around the bladder like the weave of a stretchy sock, and it has 2 jobs that must never happen at the same time. While your bladder fills, the detrusor has to stay completely relaxed, stretching quietly to accommodate the incoming urine without raising the pressure inside. Then, when you decide the moment is right, it must contract as one coordinated sheet and squeeze the bladder empty. That first job, staying relaxed and quiet while stretching, is the one that suffers with age. After 65, some of the smooth muscle in the bladder wall is gradually replaced by collagen, which is fibrous connective tissue. Collagen is strong, but it does not stretch the way muscle does. Picture the difference between a new elastic waistband and one that has stiffened after years of washing. The stiffer bladder holds less comfortably, and it signals fullness sooner, at a smaller volume than it used to. There is a second change alongside it. The nerve endings in the bladder wall become more excitable with age, and small patches of muscle begin firing on their own, rather than waiting for the brain's instruction. Continence researchers describe these as unstable contractions. They are brief squeezes that happen while the bladder is still filling, and each one produces that sudden, unmistakable sense of urgency, sometimes when the bladder is only half full. So after 65, you can be woken, not because your bladder is genuinely at capacity, but because a patch of muscle jumped the gun. Put those 2 things together with what we covered before, and you can see the whole picture. More fluid is arriving overnight because the hormonal break has softened. The container receiving it holds less and complains sooner. 2 independent changes, arriving in the same decade, compounding each other. This is why the trips increase, and it is why blaming your evening cup of tea has never explained the whole thing. There is one more layer, and it applies to men and women in different ways. In men, the prostate sits directly around the urethra, the tube carrying urine out of the bladder. From roughly the age of 50 onward, most experience gradual prostate enlargement. It squeezes that tube, the stream weakens, and the bladder cannot fully empty. What is left behind is called residual volume, and it means the bladder starts every filling cycle already part full. Less room means an earlier signal. In women, the decline in estrogen after menopause thins the tissue lining the urethra and the pelvic floor that supports the bladder from below. That support and that seal both weaken, and urgency arrives more easily. Now I want to be straightforward with you about stakes, without any drama. The real cost of frequent night waking after 65 is rarely the bladder itself. It is what the fragmented sleep does to the rest of you. Sleep researchers have repeatedly shown that broken sleep impairs balance, reaction time, and daytime alertness. Add a dark hallway, a rug edge, and blood pressure that has not yet caught up with standing, and you have the exact conditions under which hip fractures happen. Falls in the small hours are a genuine risk after 65, and they are far more preventable than most people realize. And there is one thing I need you to treat differently from everything else in this. If you ever see blood in your urine, even once, even if it is painless and never returns, that is not something to manage at home. The same applies to fever with back or side pain, or a sudden inability to pass urine at all. Those need medical attention promptly, not patience. Everything else we are discussing is about pattern and rhythm. Those specific signs are about a cause that needs identifying. So here is the question you came for, and you now have everything you need for the answer to make sense. How many times should you actually be getting up after 65? The answer is 1. Once a night is normal and expected after 65, and it needs no fixing at all. Twice is common and worth understanding, particularly if it is new. 2 or more times a night, occurring regularly, is the point at which doctors give it a name and start looking for a reason. That is your number, and it is the whole of the answer. Once fine. Twice, look into it. More than twice, and it deserves a proper conversation. Medical term for waking to pass urine is nocturia, said nocturia. And here is what most people are never told about that word. The clinical threshold is 2 or more episodes per night on a regular basis. Not 5, not 10, 2. That is a far lower bar than almost anyone assumes, and it exists for a specific reason. 2 interruptions is the point at which measurable harm begins to show up in the research, in sleep quality, in daytime function, and in fall risk. Below that, your body is simply doing what an older body does. At and above it, something identifiable is usually driving it, and identifiable things can usually be addressed. Let me connect this back to the machinery. If you are getting up once, your softened vasopressin rhythm is producing a bit more overnight urine than it used to. Your slightly stiffer bladder is signaling at a slightly lower volume, and the two combine into one trip. That is the expected arithmetic of being over 65. But when the count reaches 2, 3, or 4, it usually means one of the specific mechanisms has become dominant, rather than everything drifting a little. Leg fluid draining back. Disturbed breathing driving the kidneys. Residual volume from an enlarged prostate, a bladder firing unstable contractions. Each of those has a different approach. This is why the number is so much more useful than a vague sense of getting up a lot. 2 is a threshold you can measure yourself, tonight, with no equipment. And notice how much better this is than the 2 explanations people usually get. Most people assume it is simply drinking too much in the evening. The research points somewhere else entirely, toward the timing of the hormone and the redistribution of fluid from the legs. Most men assume it is entirely the prostate. The evidence shows the prostate is often only one contributor, which is exactly why prostate treatment sometimes fails to fix the nights. There is something else worth knowing about the number 2. It gives you a way to notice change. A stable pattern of once a night for years is very different from going from once to 3 times over a few months. That kind of shift is information. Doctors take a new or worsening pattern far more seriously than a long-standing one because it suggests something has changed, and change can often be found and addressed. So write the number down if it helps. 1 is normal after 65. 2 is the doorway. And now that you understand why, let's talk about what to do. because a good deal of this is genuinely within your control. Almost nobody notices how much of this is decided before you ever reach the bedroom. Start with the fluid in your legs, because for many people over 65, this is the single biggest overnight contributor and the easiest to shift. In the late afternoon or early evening, lie down and put your legs up so your feet are above the level of your heart. 20 to 30 minutes is enough. Propped on cushions, on a sofa arm, or with the footrest of a recliner fully up. What you are doing is deliberately draining that reservoir while you are still awake. Your kidneys process the extra volume in the evening, rather than at 2 in the morning. A gentle walk works the same way, because your calf muscles act as a pump. Do it around 5 or 6 in the evening, rather than just before bed. Second, look closely at when you drink rather than how much. This is where a great deal of harm gets done by well-meaning advice. Cutting your total daily fluid is a genuinely bad idea after 65. Dehydration in older adults brings dizziness, confusion, constipation, and a higher risk of urinary infection. And a concentrated bladder is an irritated bladder, which makes urgency worse rather than better. So keep your daily total steady, but shift it earlier. Drink generously through the morning and afternoon, and taper across the final 2 to 3 hours before bed. Front load. Do not restrict. Third, empty your bladder properly at bedtime, and use a technique called double voiding. Go, wait about 30 seconds, then try again. Because of that residual volume we discussed, especially for men with prostate enlargement, a second attempt often releases a meaningful amount that the first pass left behind. Every extra milliliter you leave the bedroom with is milliliters of room your bladder does not have at 3 in the morning. It costs you half a minute, and it works on exactly the mechanism we identified. Fourth, reduce the salt on your plate, particularly at your evening meal. Salt holds water in your tissues, and water held in your tissues during the day is water that returns to your circulation the moment you lie down. Reviews of dietary sodium and nighttime urination have found that people who reduce high salt intake often see their nighttime trips decrease as well. In practical terms, that means being watchful about tinned soups, processed meats, cheese, bread, ready meals, and takeaways in the evening specifically. You are not aiming for a saltless life. You are aiming for a lighter load on the night shift. Fifth, and this one is dull, but it is what your doctor will actually want. Keep a simple record for 3 nights. On paper by the bed, write the time each time you get up. Nothing more. 3 nights of times turns a vague complaint into a pattern, and it lets your doctor see immediately whether your trips cluster in the first half of the night or spread evenly, which points to different causes. It is the most useful thing you can bring to that appointment. And sixth, make the walk itself safe, because this is the part that actually protects you. A dim night light in the hallway and the bathroom, yet you never navigate in darkness or in sudden brightness. Nothing on the floor between your bed and the door. Slippers with a back, or bare feet, never loose slip-ons. And when you sit up, sit on the edge of the bed for a slow count of 10 before standing. That pause lets your blood pressure adjust, and it is the single most effective thing you can do to prevent a fall after 65. Now, the honest caveat, and please take this one seriously. If you take a water tablet, sometimes called a diuretic, for blood pressure, or for heart or kidney conditions, the timing of that tablet has a powerful effect on your nights. Do not change it yourself. Not by an hour, not by a day. That is a conversation with the doctor who prescribed it, and it is a very reasonable conversation to have, because sometimes an adjustment is appropriate, and sometimes it absolutely is not. The same goes for anything you take for diabetes, and for any supplement if you have kidney disease. Bring the 3-night record, ask the question, let them decide. There is one more thing to raise with your doctor if it applies. If you snore heavily, wake unrefreshed, or someone has told you your breathing stops and starts in the night, mention it in the same appointment. Given the connection we discussed between disturbed breathing and the kidneys, treating that can improve the nights in a way no amount of fluid timing ever will. Now, I want you to pay close attention to this next part. because you can do every single thing I have just described and still lose the benefit to one ordinary habit. And it is a habit almost nobody suspects. It is the evening drink. Specifically alcohol, and specifically in the 2 or 3 hours before bed. A glass of wine with dinner, a beer in front of the television, a small nightcap because it helps you drop off. This is what makes it so easy to miss. It genuinely does help you fall asleep faster. So it feels like it is helping, right up until 3 in the morning. Here is the mechanism, and it lands precisely on the machinery we built earlier. Alcohol suppresses the release of vasopressin. Remember the hormone that reaches over and turns down the tap on your kidneys. Alcohol tells your brain to release less of it at exactly the hour when your aging body was already struggling to produce enough. So the brake that had already softened with age is now released almost entirely. Your kidneys spend the night running at full daytime speed, and the fluid arrives in a bladder that already holds less than it used to. Then it does a second thing. Alcohol is an irritant to the bladder lining, and it makes those unstable contractions in the detrusor muscle more likely. So you get more volume arriving and a twitchier container to receive it. That is both mechanisms we identified, worsened at once by one glass. And there is a third effect that catches people out. Alcohol fragments the second half of your night, regardless of your bladder. As your body clears it, sleep becomes shallow and easily broken, which means you wake more readily to a bladder signal you might otherwise have slept straight through. The same is broadly true of caffeine in the evening, which is both a mild diuretic and a bladder irritant, so coffee and strong tea after mid-afternoon are worth the same scrutiny. The fix does not require giving anything up. It requires moving it. If you enjoy a drink, have it earlier, with your evening meal rather than in the hour before bed. 3 hours between your last alcoholic drink and your pillow is enough for most people to see a difference, and a glass of water alongside it helps. Many people find that this single change removes 1 trip a night on its own. Try it for a week and count. You have the record sheet already. So if there is one thing to carry away from all of this, let it be the number. Once a night after 65 is normal. Twice or more on a regular basis is worth a conversation with your doctor, and it is very often fixable. If this was useful to you, subscribe, because we go through the things that matter after 60 in exactly this kind of detail. And there is a great deal that never gets explained in a 10-minute appointment. And I would genuinely like to know, how many times are you getting up in the night? And does your pattern fall in the first half of the night or spread right through it? Leave it in the comments, because a lot of people reading them are quietly wondering whether they are the only one. Here is what I want you to hold on to. For years, you have probably been told this was simply your age, and that nothing could be done. That was never true. You now understand the hormone, the reservoir in your legs, the muscle in the bladder wall, and the threshold that tells you when to ask for help. You know what to do this evening, and you know the one drink to move earlier. This is not a decline you have to accept quietly. It is a system with rules, and you now know the rules. Everything in this video is for general education and is not medical advice. Please talk to your own doctor before changing anything about your diet, your medication, or your routine.